Factors affecting the healthcare system in the Philippines. The Philippine healthcare system is a complex tapestry woven from history, theory, and a multitude of factors that influence its effectiveness. Here's a breakdown of these elements. History. The journey of the Philippines healthcare is a story of evolution shaped by its colonial past and its quest for a modern, accessible system. Pre-colonial era. Before the arrival of colonizers, Filipinos relied on traditional healers and medicine men, using herbs and rituals to treat ailments. Spanish colonial era, 1565 to 1898, the Spanish introduced Western medicine, establishing hospitals and medical schools. However, these benefits were primarily reserved for the elite. American colonial era, 1898 to 1956. The Americans brought a focus on public health and preventive medicine, establishing rural health units and promoting sanitation. Post-independence, 1946 to present. The Philippines has strived to build a national healthcare system with significant steps like the establishment of PhilHealth in 1995, a health insurance program aimed at providing universal coverage. Several theoretical frameworks guide the Philippine healthcare system, shaping its goal and approaches. Universal health coverage. The overarching goal is to ensure everyone has access to quality healthcare services regardless of their ability to pay. The Universal Healthcare Act 2019 aims to achieve this ambitious vision. Theory. Primary health care. This framework emphasizes preventive care and community-based health services, bringing healthcare closer to people and addressing issues at the local level. Health system strengthening. This approach focuses on improving the overall efficiency and effectiveness of the healthcare system by strengthening its various components such as infrastructure, workforce, and financing. Factors affecting the Philippine healthcare system. A. Funding and financing. Inadequate healthcare budget. The government's healthcare budget is limited compared to other countries, restricting resources and hindering the system's ability to expand and improve. Example, Philippines spent only 4% of its GDP on healthcare in 2020, significantly lower than OECD average of 10%. Whereas GDP, gross domestic product, this is the total value of all goods and services produced within a country in a specific period, usually a year, is a means of a country's economic output and is often used as an indicator of its overall economic health. OECD, which means Organization for Economic Cooperation and Development. This is an international organization made up to 38 member countries, mostly developed economies. They work together to promote economic growth, social well-being, and global development. In the context of the healthcare system, the statement the Philippines spent only 4% of its GDP on healthcare in 2020, significantly lower than OECD average of 10%, means that the Philippines allocated a smaller percent of its total economic output to healthcare compared to the average spending of countries in the OECD. This suggests that the Philippines may not be investigating as much its healthcare system as other developed economies, potentially impacting the quality and accessibility of healthcare services for its citizens. Example number 2. This limited budget often translates to a lack of modern equipment, insufficient staffing, and inadequate maintenance of healthcare facilities. High out-of-pocket payments. Many Filipinos pay for healthcare out of their own pockets, placing a heavy financial burden on households, especially the poor. Example, this can lead to delayed medical attention as families prioritize basic needs over healthcare, resulting in more severe health conditions. Another example, many Filipinos skip necessary treatments or medications due to high costs, impacting their overall health and well-being. Number 3, limited health insurance coverage. While PhilHealth aims to provide universal coverage, there are gaps in its reach, leaving some Filipinos without adequate financial protection for healthcare. Example, those in the informal sector like street vendors or farmers often lack access to PhilHealth benefits due to their employment status. Another example, individuals with pre-existing condition may face challenges in accessing PhilHealth benefits, leading to financial hardship when seeking medical care. B. Human resource. Shortage of healthcare professionals. The Philippines faces a strong shortage of doctors, nurses, and other healthcare professionals, particularly in rural areas. Example, the doctor to population ratio is lower than the World Health Organization, whose recommended ratio leading to longer wait times for appointments and limited access to specialists. Another example, rural hospital often struggle to provide comprehensive care due to a lack of skilled professionals, forcing patients to travel long distance for specialized treatments. Number 5, brain drain. Many Filipino healthcare professionals migrate to other countries for better opportunities. Further exacerbation the shortage at home. Example, the Philippines lost skilled nurses and doctors to countries like the US and Canada, impacting the quality of care available to Filipinos. Another example, this migration often leaves rural areas with even fewer healthcare professionals, creating a cycle of limited access and poor health outcomes. Number 6, uneven distribution of healthcare workers. Healthcare professionals tend to concentrate in urban areas, leaving rural communities underserved. Example, this creates a disparity in healthcare access, with urban residents enjoying greater access to specialists and advanced medicine facilities compared to rural communities. Another one, rural health hospitals may have fewer doctors and nurses, leading to longer wait times for appointments and limited access to specialized care. C. Infrastructure and accessibility. 7. Inadequate healthcare infrastructure. Many rural areas lack adequate healthcare facilities, including hospitals, clinics, and essential medical equipment. Example, some communities may only have basic health centers, lacking the capacity to handle complex medical cases, forcing patients to travel long distance for specialized care. Another one, the lack of proper facilities and equipment often leads to delays in diagnosis and treatment, potentially worsening health outcomes. Number 8, limited access to medical equipment. Even existing facilities may lack essential medical equipment, affecting the quality of care provided. Example, rural hospital may struggle to perform certain procedure due to a lack of advanced diagnostic equipment, limiting their ability to provide comprehensive care. Another one, this lack of equipment can also lead to delays in diagnosis and treatment, potentially impacting patient outcomes. 9. Geographical barriers. The Philippines' archipelagic nature makes it challenging to provide healthcare services to remote and isolated communities. Example, transportation costs and limited access to communication infrastructure hinder access to healthcare in rural areas, making it difficult for patients to reach facilities and for healthcare providers to connect with them. This geographical isolation often leads to delays in seeking medical attention, exacerbating health issues and potentially leading to wars. D. Social and cultural factors. Poverty and inequality. Poverty limits access to healthcare for many Filipinos, leading to disparities in health outcomes between different socioeconomic groups. Example, poor families may delay seeking medical attention due to the cost of treatment, leading to more severe health conditions that require more expensive and complex care. Another one, this lack of access to healthcare can also lead to a cycle of poverty, as individuals are unable to work and contribute to their families' well-being due to untreated health issues. 11. Lack of education. Limited education can lead to poor health choices and difficulty navigating the healthcare system. Example, some Filipinos may not understand the importance of preventive care or may rely on traditional remedies instead of seeking medical attention, potentially delaying diagnosis and treatment. Lack of health literacy can also make difficult for individuals to understand medical information, follow treatment plans. 12. Cultural beliefs. Cultural beliefs about illness and healthcare can influence people's willingness to seek medical help, leading to delays in treatment or reliance on traditional practices that may not be effective. Example, some Filipinos may delay seeking medical attention due to fear of stigma associated with certain illnesses or may prefer traditional healing methods over Western medicine. Another one, cultural beliefs can also influence the acceptance of modern healthcare practices such as vaccination, which can have a significant impact on public health. E. Health outcomes and disease burden. High prevalence communicable disease. The Philippines still faces challenges with communicable diseases like tuberculosis, HIV, AIDS, and dengue, which can strain health resources and impact public health. Example, the re-emergence of polio in 2019 highlighted the need for improved vaccination programs and public health measures to prevent the spread of communicable disease. Example, these diseases can lead to significant morbidity and mortality, particularly among vulnerable populations, placing a burden on the healthcare system. 14. Rising non-communicable disease. The country is seeing an increase in non-communicable disease like heart disease, diabetes, and cancer, linked to lifestyle factors and aging populations. Example, lifestyle factors like poor diet, lack of exercises, and smoking contribute to the rise of this disease, playing a burden on the healthcare system for treatment and management. Another thing, this disease often require long-term care and management, placing a strain on healthcare resources and impacting quality of life for individuals and families. 15. High maternal and newborn mortality rates. The Philippines has higher maternal and newborn mortality rates than many other countries, indicating challenges in accessing quality prenatal care and skilled birth attendance. Example, lack of access to quality prenatal care and skilled birth attendance can lead to complications during pregnancy and childbirth, contributing to these high mortality rates. This highlights the need of improved access to maternal health care services, including skilled personnel and essential medical equipment to ensure the safety of mothers and newborns. 16. High fertility rate. The Philippines has a relatively fertility rate which can strain healthcare resources, particularly for maternal and child healthcare services. Example, more births means a higher demand for maternal and child healthcare system, putting pressure on existing resources and potentially leading to overcrowding and longer wait times. This also highlights the need for family planning programs and access to reproductive healthcare services to help families make informed choices about their reproductive health. F. System-wide challenges. 17. Fragmented healthcare services. The Philippine healthcare system is fragmented, with public and private sectors often operating independently, leading to inefficiencies and duplication of services. Example, coordination between public and private providers can be challenging, leading to delays in referrals and fragmented care for patients. The other one, this fragmentation can also lead to a lack of standardized protocol and data sharing, making it difficult to track health outcomes and implement effective policies. F. System-wide challenges. Lack of data and information. Limited data collection and analysis hinder the development of effective healthcare policies and interventions. Example, a lack of comprehensive health data makes it difficult to assess the true needs of population and track progress towards health goals. Another one, without reliable data, it's challenging to allocate resources effectively, target interventions accurately, and measure the impact of healthcare programs. 19. Corruption and inefficiency. Corruption and inefficiency within the healthcare system can hinder service delivery and resource allocation, diverting funds from essential services and impacting the quality of care. Example, mismanagement of funds of favoritism in hiring can lead to inadequate resources of healthcare facilities, impacting the quality of care provided. Corruption can also discourage qualified professionals from entering the healthcare field, exacerbating the shortage of healthcare workers in the country. 20. Lack of public-private partnership. Limited collaboration between the government and private sector can hinder innovation and resource sharing, potentially leading to a less efficient and effective healthcare system overall. Example, stronger, stronger partnerships could lead to better infrastructure developed training programs, and access to technology, improving the quality and accessibility of healthcare services. Another one, collaboration, could also foster innovation in healthcare delivery models, leading to more efficient and cost-effective approaches to providing care. Conclusion: the Philippine healthcare system is facing significant challenges, but it also undergoing ongoing reforms to improve access, quality, and efficiency. Addressing this factor is crucial for ensuring a more equitable and sustainable healthcare system for all Filipinos. It's a journey that requires the dedication of policymakers, healthcare professionals, and the community as a whole to build a healthier future for the Philippines. Thank you.